I'm very happy to talk about this product, about this device, which unfortunately I have not been able to get my hands on yet because I'm in Europe and it doesn't have CE mark. But I'm particularly interested because this really proves one of my theses of the feasibility of autonomous surgery. It's really a beautiful example of, level 5 autonomy, where essentially a device is able to treat a tumor independently in many ways from human intervention. So to kind of understand what I'm talking about, I should mention I'm originally from the United States, but I now work in Paris. I'm at the hospital Antoine Becler, and I'm going to talk, Professor Ishizawa was kind enough to introduce me. But I want to kind of get into the definitions because a lot of people don't understand what robotic surgery is, what artificial intelligence is, what autonomy is, what surgery is today. Should we be using terms like percutaneous surgery for, traditional ablative techniques, and things like that. So let's go a little further. I do my artificial intelligence research at the University of Magdeburg in Germany. So just some disclosures. As mentioned, I'm editor-in-chief of Artificial Intelligence Surgery, and we're hosting this webinar. I'm not going to be talking about too many of these disclosures, so we can skip that. We'll talk briefly about the journal. We're going to talk about a consensus conference about definitions of surgery, because definitions are really evolving rapidly right now. So we're actually going to have a conference in Italy, September 26th. University of Padova, and Takeaki Ishizawa is invited, and we look forward to seeing him again. And I also want to talk a little bit about non-invasive surgery, the concept of non-invasive surgery. We don't really know what to call this type of procedure with histosonics. So I'm sure the other experts, the actual experts will weigh in on this, but I want people to start thinking about how we start to term these new procedures. So this is the journal. We've been around for, we're on volume 5. I think we're actually, issue 1 was published actually a month or so ago. This is the website. Our first official impact factor is coming out actually next month, and it's calculated at 3.3. So we're very excited about that. So if you're interested in this topic or these type of topics, please check out the journal. So this is the consensus conference that we're going to do on definitions of artificial intelligence for the next generation of surgeons. As I mentioned, it'll be in Italy. So check the website for information on that. And we're also, because of new technologies like histosonics, we felt that we really needed a society that talks about artificial intelligence and the new way of doing surgery because of artificial intelligence. Professor Ishizawa is one of our founding members, so we're happy to have him at the conference. And so if you're interested in this topic, we'll be announcing this organization soon, so you can become a member if you're interested in it. And it stands for Artificial Intelligence Organization of the Next Generation of Surgeons, or as I like to say, for the next generation of surgeons. So what is surgery nowadays? It's an interventional medical procedure that's not just traditional surgery. It's not just traditional laparoscopic surgery. It's not just traditional surgery with the Da Vinci. It's also ablative techniques, with the needle, percutaneous ablative techniques. We like to call that percutaneous surgery. It's also endoscopy, endoluminal surgery, natural orifice, transluminal endoscopic surgery. As we get better and better technology, more and more AI, surgery is becoming less and less and less invasive. And to the point where in many ways, with things like histosonics, you could argue that we have something now that should be perhaps termed non-invasive surgery until we can think up of a better term. This is kind of what we're going with for the moment. What surgery is now and what it will be in the future is going to be very different. And we have to have a very open mind of what surgery will be, because if surgeons don't adapt to the new technologies and they keep their blinders on, surgeons are going to kind of, become dinosaurs, if you will. So I'm very passionate about teaching this generation of surgeons about AI and to see how it'll impact their life. And because of that, I highly recommend they pay attention to histosonics. So what is a robot? It's a device that can replicate or replace the actions or decision-making capabilities of a human. Okay, so the Tbilisi robot is really just a telemanipulator. It's just a remote control device. It's not a true robot. But in many ways, the Histosonics is a true robot, and it is true robotic surgery. So what are autonomous actions? You can have weak AI, you can have strong AI, you can have an automatic action, you hit a button, it just does something, or you can have strong AI or an autonomous action where there's a sensor, there's some data being interpreted, there's an algorithm being used, and the machine is making decisions for you. So we don't have time to go through all the 6 levels of surgical autonomy, but we're going to go right down to level 5, just so you understand, full autonomy. I should say level 1 is where the Da Vinci is. It's very low autonomy. It's just telemanipulation, just remote control. Level 5 is full autonomy. Once you set up the Histosonics, again, the experts will correct me if I'm wrong, but the robot then does the procedure. Obviously the human has to help set it up, but then once it's engaged, maybe we should probably use level 4 for Histosonics. But again, the experts who actually use it, they'll tell me, what they think we should term it. So cancer, Takiaki and I and the other doctors here, we're interested in cancer. We're surgical oncologists. There's a huge problem with solid tumors, okay? And that's the name of the game here. So do we really want to do resections? Do we want to do percutaneous ablations where you have to stick a needle in things? Or do we want to use something like Histosonics is really the name of the game? So we talked about percutaneous surgery. All I want to say here with this slide is that surgeons in this day and age, they need to learn how to do percutaneous surgery, or they need to learn how to do things non-invasively, like with Histosonics. It's the future. It's clearly the future, and it's very important. So as we can see, there are many different types of tumors that out there. I don't need to give people a lecture on this, but this is a huge problem for public health. Okay, and there are multiple applications for things like ablations or for non-invasive things like Histosonics. All right, so this is a video I'm gonna not show because I'm gonna let other people probably show it. But just to conclude, what is non-invasive surgery? Really, Histosonics sounds to me like it is non-invasive surgery. So hopefully we have some time to talk about it at the end. We're not making an incision. We're not entering a natural orifice. The closest thing that Histosonics seems to me is the CyberKnife or external beam radiation therapy. And interestingly, the CyberKnife was invented by a neurosurgeon, and it implies surgery. It's an intervention, but there's no incisions being made, and the patient's body isn't being quote unquote violated. So with that, I think Histosonics is a prime example of level 4 or 5 autonomous surgery. Maybe it's the best example that I've seen to date of true artificial intelligence surgery. And really, we're here to find out, is Histosonics the future of surgery, of treatment of solid organs, of solid tumors, okay? So just want to note that there's going to be a dinner at the EAHPBA Monday, what is that, June 9th? Okay, if you're interested, I'm going to be at the European American HPB Association. I hope to attend this, and I just want to let people know, if you're interested in this device, which I think is really a game changer, I encourage you to show up, okay? So I think with that, I will say thank you and turn it back to Professor Ishizawa.